Good afternoon, everybody, and welcome to Noon Seminar. So today's Noon Seminar is sponsored by HART, which is one of the programs within the department's Early Childhood Services Research Program that focuses on early childhood home visiting. HART is a federally funded research and development platform led by Drs. Ann Duggan and Allison West in the department. It seeks to increase the home visiting field use of research to answer the question, what interventions within home visiting work best, for which families, in which contexts, why, and how? And HARC uses a framework called the precision paradigm as an overarching framework to help answer this question. The precision paradigm supports the home visiting field in becoming more specific about how techniques are used by home visitors that influence mechanisms of action that shift family behaviors to move outcomes. It also considers moderation by engagement in services and context, so environment and then characteristics of families and home visitors. Dr. Kalil's presentation today will provide a background in behavioral economics and highlight her research that helps us understand how maternal attributes can moderate the impact of parenting interventions. And we're really thrilled that she's here today to share with you all. We have plenty of time for questions afterwards, so please feel free to drop them in the chat if you think of any during the presentation. As a little bit of background, Dr. Kalil is a professor at the University of Chicago Harris School of Public Policy. At Harris, she directs the Center for Human Potential and Public Policy and co-directs the Behavioral Insights and Parenting Lab. She also holds an appointment as an adjunct professor in the Norwegian School of Economics in Bergen, Norway. She is a developmental psychologist who studies economic conditions, parenting, and child development. Her current research examines the historical evolution of income-based gaps in parenting behavior in children's cognitive and non-cognitive skills. In addition, at the Behavioral Insights and Parenting Lab, she is leading a variety of field experiments designed to strengthen parental engagement and child development in low-income families using tools drawn from behavioral economics and neuroscience. And Dr. Kalil received her PhD in developmental psychology from the University of Michigan. So I will now turn it over. So thank you and welcome to the department.
Thank you. Thank you so much. It's a real pleasure to be here. And I'm very much looking forward to getting your feedback and getting your questions and seeing how we can think about these ideas as I hope to talk a lot further with your group going forward. So thanks for the kind introduction. As Kay said, I'm going to be talking about behavioral insights and parental decision-making. And I'll explain what I mean by both of those things momentarily. But what I really hope to do today is draw out some of the implications for how we think about intervention, home visiting being an obvious one. But I think what I hope to convince you of is that our research, has implications for other modalities of intervention as well, moderation of treatment impacts and sort of precision targeting of how we might think about interventions. So to begin, I want to just lay the groundwork for my talk with a few facts. These are facts that I've spent a long time studying, producing some of them myself, but they really lay the foundation for everything that I care about, everything I've been studying for the past 25 years. So let me just begin with that, a couple of slides on some foundational ideas. The first challenge or social problem that motivates my work is displayed here in this figure, which is the gap in children's cognitive test scores by family background. Here, I'm looking at mother's education as a marker of family background. We could swap this out with family income and produce almost exactly the same picture. But what you really need to take away from this figure, the first is probably obvious to you, that children of college-educated mothers have higher test scores than their peers whose mothers have less than a high school degree and so forth. That's one. Two, that these gaps in kids' cognitive test score open up really as early as we can reliably measure them. So here I'm showing you that the gaps are present already at age 3 developmental psychologists like me have ways of measuring these skills, both cognitive and behavioral skills, even younger than this age. And these gaps are present even at that point. But third, the gaps, as you can see, show little change over the course of children's schooling years. So basically, children are in about the same position at age 18 relative to their peers as they were at age 3. So this says to me a couple important things. One, where are children at age 3? Well, they're mostly at home in the company of their parents or the other caregivers who care for them in the home environment. And as I'm sure you know, even fewer low income than higher income children are in a high quality out of home environment. So I think this really directs our attention to the home environment and the relevance of parents and how parent-child interaction in the home environment might shape early skill development. Second, I think this persistence of this gap by family background over kids' schooling years makes us have to stop and say something like, we can't expect schools alone to close this gap. Now, I know the audience to whom I'm talking today, and so I think I'm preaching to the choir, but I think it is often sort of our default position is these gaps exist. This is an important problem. Let's look outside the home environment to schools, for example, or preschool to try to close those. I'm certainly not opposed to those ideas, but I think if we would do that and neglect the role of the home environment would be a big mistake. So that was fact number one. Oops. I'm also, just going to tell you, I don't even have any data to show you here, but lots and lots of data behind the argument I'm making here, that again, that parents play an important role in those gaps in children's early skill development. I've long argued that parents are the single greatest influence on children. We know from many different studies that parental engagement, that is parents' ability to support their kids' skill development, varies by parents' socioeconomic advantage or disadvantage. And there's a reasonable number of studies to suggest that what parents do actually matters for children's outcomes. Now, I want to be a little bit more circumspect about this last point because actually there's less causal evidence than I think we would wish to support that last statement. In part, it's because we have been relatively less able to experimentally manipulate parent behavior to get a sort of first stage in what you'd need to prove a causal link. So if we can manipulate parenting behavior either through an actual experiment or a natural experiment, how much would that move the needle on some measure of kids' skill development? That's what we would like to have. There aren't that many studies that give us those data that we need, but I'm going to stand by my theoretical proposition that what parents do matters a lot for kids' skill development. And again, this is a slide I like to show a lot. You know, if you don't believe me, you can just look at time diary data and find out where are children spending their time. And if we want to just set up this contest between the time that is spent with parents, family, caregivers, or environments selected by those caregivers versus the time children spend in school, you can see that the clear winner is the share of time that American children spend with their family. And I can say this is time awake, so non-sleeping hours spent in these two different environments. Clearly, the lion's share of time is spent with family from birth to age 18. Again, another stylized fact, these are some data that I have produced, published in Demography, the journal Demography a few years ago, just showing sort of descriptive facts that more highly educated parents here, this is mother's time, spend more time on any given day in various activities with their children. So this is just data from the American Time Use Study showing minutes per day that mothers spend with their children at the preschool age. So this is for in households with children ages 3 to 5, for example. And you can see that college-educated mothers spend more minutes per day, both in basic care, in play, and in teaching. So 2 things I want to point out here. You could probably reasonably say, well, gee, that's only 4 minutes a day more on any given day that college-educated mothers are spending with their children in something like teaching. And that's true, but remember, this is just one day out of many, and you might do a thought exercise to say, if we added up those daily differences, if this one day was representative of all days, that time would actually start to look more substantially different. The other thing I want to tell you, which is not so obvious from this slide, is that the margin that gives rise to these differences is the difference in the share of mothers who spend 0 minutes versus any minutes on these activities on any given day. Okay, so this figure here includes the zeros. If I were to condition on any minutes, these gaps would shrink more. This is super important from an intervention perspective to me, because what it suggests is that we should be trying to move the needle from doing nothing on any given day to doing something, and making a habit of doing something most days. This has become my mantra of how we should think about intervention, because as you can see, it's not like college-educated mothers spend 2 hours a day reading with their children. That's just not the goal of our intervention. And so I'm going to just let you know that, and we can think about the implications of that perspective for our intervention. Okay, so when we think about accounting for these differences in parenting behavior, which I've just given you the most cursory of oversights to let you know they exist, we want to think about what gives rise to those differences, because if we don't know what accounts for those differences, we won't know how to design our interventions. So I'm going to just present here the way I think about this, which is that there are 3 dominant theories that we bring to this challenge of differences in parent behavior by parental education or income. I'm going to say that a pretty dominant theory is that structural issues matter a lot. And let me just say at the outset, I think all of these are true to some extent, and that our challenge is to figure out which one is true for the problem we're trying to solve. And it'll become clear in a minute that my own research in my lab is focused on what we're calling cognitive barriers. But let me just say the other one. So we have many studies, lots of great research to suggest, not at all surprisingly, that low-income parents can't afford the goods and services that matter for children's skill development. High-quality education, high-quality healthcare, high-quality housing in a high-quality neighborhood, all those structural factors matter for children's skill development. And there is an unlimited number of studies to show that low-income families have less access to those important inputs. I'm just going to repeat again that there's less information on the causal connection between those factors and kids' skill development. We simply don't have a lot of successful experiments that have manipulated those factors. There's some great new studies going on right now. Babies' first years, our first unconditional cash income transfer experiment led by Greg Duncan and others. That's really going to be our first. I just can't wait for those results because they don't exist now, and they're going to be so important to really help us understand what is the causal impact of an unconditional cash income transfer on young children's development, for example. Okay, second, information. Lots of theories to suggest that low-income parents either know less about what it takes to promote young children's skill development, or maybe they know theoretically what those things might be, but don't know how to execute or implement those particular behaviors. you're the experts in the audience, I think, on this point, because it's my observation that much of our home visiting programs are based on this idea, that a lot of what we're trying to do in home visiting is provide information. Let parents know facts about children's development, let parents know about how important it is to talk to children before they can speak, etc. So 100% correct me if I'm wrong, but this is my reading of that literature. And I'm going to show you some data. We do a lot of survey work with low-income families in Chicago and elsewhere that suggests that may be true, but that low-income parents also do know a lot about parenting, and that what we might want to focus on instead, or in addition, I can say, again, I'm not ruling any of these out, is that the differences arise from what I'm going to call cognitive barriers, which is what I'm going to say are factors in the decision-making environment that stand between intention and action. And as I move along in this talk, I'm going to give you some examples, and hopefully it will become more clear what I mean. We can certainly think about stress as a cognitive barrier and the role that stress plays in shaping our decisions to do what we said we wanted to do, or and so forth. There's a range of other things I'm going to call cognitive barriers. Which I'm going to get to. Something is. Not talk this. So this is just one slide out of many I could show you data that we have collected, again, from low-income families in Chicago, thousands of parents in our surveys, that just make me want to argue that I think low-income parents do know many things. Again, we just ask parents a simple question. Were you to read more minutes with your child, for example, on any given day, how much more ready for school would your child be? And parents at least tell us that they understand this sort of production function of their input, that, were they to do more reading, and I could show you a slide like this for math or any other kind of input that we can imagine, many low-income parents seem to at least tell us that they understand that there would be a return on the time that they would spend. Okay, so moving on. So shifting, so that's the end of the section on the talk on the facts that motivate what we're doing. So now let me, just do the warm up to some actual data that I'm going to show you from some field experiments that we've done in our lab and what has motivated that work. So I've been really compelled by the facts presented on this slide, facts with which I'm sure you're super familiar. I had the chance to work with some amazing students a couple of years ago on a project at the University of Chicago called Data Science for Social Good. And the project that I supervised was a collaboration between the students who were budding data scientists and the National Nurse Family Partnership Program, which provided the students with all the data on attrition nationwide over some number of years. And again, this will come as no surprise to you, but I was pretty astounded to see that fully half of the families who enroll and even begin the program have left by the theoretical halfway point of that particular program. And when I say leaving, I mean the students sort of coded leaving into like you graduated and the practitioner thought that you had completed what the program, versus you could no longer be found for the rest of the time you were supposed to be in the program. And so this is really a conservative estimate of leaving the program for reasons that were not coded as optimal ones. So a very large share attrits from the program. And then in early Head Start, which, as you know, also has a home visiting component, practitioners themselves rate a large share of families as inconsistently engaged. So I know you're working on these challenges also. And, I'm curious sort of what is the theory of change here, and how might we, think about it further to try to solve some of these problems? And this is the way that I have come to think about it. And that is this, I think, kind of tension between how developmental psychology thinks about parenting. And remember, developmental psychology is my own field. So this is how I was trained, versus a way of thinking about decision-making in general, which really comes out of behavioral economics and social psychology and the general field of cognitive science and decision-making. And I'm going to try to describe what I see as this tension. I'm going to just argue that the traditional developmental psychology lens that says what is good parenting is that it is sort of, well, it's a style. I mean, we use these words, parenting style, and we have this, Diana Baumrind taxonomy of different parenting styles, where we have, as again, I'm sure we have authoritarian and authoritative and a couple other ones. And we have this notion that parenting style is like a very long list of things that the child needs to develop successfully. And it seems to me that often our theory in our interventions is to try to A, change all those things at once, B, in the service of shifting parents from being one type of style to another type of style. And maybe I'm exaggerating a little, but this is just how I read that theory. I just don't know exactly what to make of that. I don't know how we would measure that. I don't know how we would, measure a change in parenting style. And I think we are just setting a really hard task for ourselves when we say, here's a very long list of all the things, all the inputs kids need. Let's try to change them all at once. So I'm going to contrast that with the way that we have come to think about parenting in our research lab, which takes what I'm calling a behavioral insights lens and simply says, parenting is a series of decisions. Some decisions are made every day. Some decisions are made once. People make different types of decisions in different environments, depending on how they feel, depending on the decision somebody else made, depending on what they were thinking that day. And our goal as practitioners, I mean, I'm not a practitioner, as you know, as a research scientist, is to try to say, parents, low-income parents, high-income parents, all have goals. How do we simply help close the gap between what parents say they want to do and what they actually do? That's all I'm trying to do here. And I'm trying to use a behavioral insights lens, a decision-making lens, to solve that problem. Now, of course, I'm not going to take an extreme position and say that everything every parent says they want to do is optimal. Surely there are some things that everyone would agree parents should not want to do. But I'm talking about what I think is a pretty big realm of pretty sound parenting practices that many low-income parents understand and theoretically say they want to do, but then we can look at the data that we have and we can observe that they're not doing it. And we simply have to say, why is that so? And how can I move that needle? So that is kind of the organizing framework for what we're doing. And I'm going to spend like 2 slides here telling you a little bit more about this behavioral insights lens. And then I'm going to show you some results from one of our field experiments. So here's where I'm going to introduce this idea of cognitive biases. And what I mean by cognitive biases is simply are factors in the decision-making environment. You could say your social context, your day, the decision that's being presented to you that shape the decision you make in a way that leads you to a suboptimal decision. And what I mean, this is super important, by suboptimal is you made a decision that is not the one you said you wanted to make. So we're not in the business of telling parents what they should do, but rather saying, as I've now repeated many times, what do you want to do? And the optimal decision is you do what you said you wanted to do. And so I'm not going to spend a huge amount of time like going through these in detail there. Let me just say there's a giant taxonomy of these cognitive biases. And I think some are more well supported by theory and evidence, and a lot of others are not. And I don't think it would behoove any of us to be working our way through all 150 possible cognitive biases that are listed on this taxonomy. But there's a few here that I think are quite well supported. Our innovation in our research lab has been to apply these to the realm of parent behavior. So much of this work, as you probably know, has arisen from health behavior. Why don't people exercise? Why don't they eat right? Why don't they take their medicine? And financial savings behavior. Why don't people save for retirement, etc. Pretty, basic decisions where people have a theoretical knowledge of the right thing to do and don't do it. And again, as I said, we just said, that looks pretty interesting. I wonder if we can apply that to the decisions that parents make. So we think that parent decision-making may be especially susceptible, A, to cognitive biases, and more importantly, perhaps, is that we have argued in our lab that the experience of cognitive biases and people's adaptation to them may differ by parental advantage. So let me also just say that we don't aim, you can't eliminate these cognitive biases. Okay, we don't get rid of our tendency to make an impulsive decision. Rather, what we do is we manage it. Right. So I have, maybe I've got reminders all over my social environment, reminding me, not to be forgetful, or reminding me of some future goal that I have, something like that. Maybe I'm better able to manage my tendencies to make an impulse decision when I'm not stressed. And maybe I think we can, probably all agree that low-income families may be more exposed to stress and other factors that stand in the way of managing these different biases. But let me just say super quickly one word on what each of these is, and then let me get to some data. So present bias, which is going to be the focus of actually the data that I'm going to show you, is basically impulsivity. Is our tendency to go for the immediate temptation rather than being patient for the longer run reward. I think it's pretty clear for those who study parenting that it requires making a lot of these temporal trade-offs, right? I read to my child every night now, if I have a young child, in the hopes that they'll be ready for school maybe years from now. And I don't get sort of immediate feedback the next day that my effort has been fruitful. So it really requires an understanding that, the payoff to anything I do now, may not emerge until much later in the future. Frankly, in parenting, may never emerge. I just have some good faith assumption that what I'm going to do is going to matter in the long run. If you don't have that ability, that's probably going to shape the effort you put in now. Attribution bias is our ability to understand why other people do the things they do. Pretty central to parenting. Why is my child crying? Are they hungry or tired? And if that's the case, what should I do? Are they a torment? Are they out to just to stress me out? Well, that's going to lead to a very different reaction from me as a parent. It's super hard to make attributions for others' behavior when they can't tell you how they're feeling or thinking. Parenting decisions are often automatic. Automaticity bias. This is probably generally fine. Most of us make lots of our decisions without overthinking them. Again, we don't have the cognitive bandwidth to think through every decision we make. So there's nothing inherently wrong with making automatic decisions unless those decisions are being made, I would just argue, in a very closed social context where we don't understand that we may be repeating lots and lots of decisions, maybe like the parenting that we ourselves grew up with, and new information is not getting into that social network in which we're operating. And then finally, I'm just going to say that parenting decisions are experienced as identity relevant. So the identity that we hold in any given moment is going to shape the decisions we make. As a parent, I may feel like a parent and act accordingly when I'm at home, but maybe when I go to work, I adopt the identity of a researcher or an employee or employer. And I think to understand why parents or anybody makes the decisions that they do make, we want to understand the identity that they feel in that moment. So if I come home, for example, and I'm still in the identity of researcher or employee, maybe I spend all night checking my email. And maybe it would have been better for my child's development if I had, been able to invoke the identity of parent and made a different decision to spend time with my child. So I'm just presenting these all to you as theoretical possibilities for the factors in the decision-making environment that shape the decisions we make, try to let you know how I think they're relevant to parenting decisions. And I'm pretty interested in these ones in particular because I think they are amenable to intervention. Okay, so that's the very long warm-up, and let's get to some data for what we actually have done. So this is what we do in our research lab. We're really adopting this thesis that these cognitive processes or cognitive biases prevent parents from making the decisions that they said that they want to make. And I think if we adopt this particular kind of lens, as opposed to the more traditional developmental psychology lens, it gives us much more precision in understanding the specific behavioral constraints on optimal decision-making, much more precision in where we want to intervene. What exactly do we want to move here? The other element of this approach, which is, I guess, sort of serendipitous from my perspective and what the research shows us, is that it turns out it's possible to manage these cognitive biases in ways that are relatively inexpensive and theoretically more scalable. I'm sure you have now seen that we have a lot of interventions which don't rely on an actual person or practitioner at all, but rather, setting up reminders for parents or managing other cognitive biases by communicating with parents through text messages. This is some of the work that we also do. I'm not suggesting that that's the only approach or that it's possible to solve every low-income family's challenges by, texting them forever. But I do think that this work has opened up some new possibilities which can complement more complex, more intensive, and more expensive approaches for families who have those needs. But I, as I said, have been inspired and sort of excited by the idea that it's possible to move the needle in ways that we hadn't previously identified that are pretty cheap because we now have technology that we haven't always had and so forth. Okay. So again, this is what we do. We design these behaviorally informed interventions. In my research lab, we're really trying to understand the tools to help change parental behavior in ways that parents themselves say they want to change. And we're doing a lot of field experiments, randomized control trials, and a lot of in-depth surveys here in Chicago and elsewhere. And let me see, this is our, our metaphor, closing the gap between aspirational parenting and actual parenting. So I want to spend, a few minutes just talking about one of our, we sort of call it our flagship field experiment. It's been published already. It's in the Journal of Human Resources, but it was sort of the first field experiment that we did in the lab a few years ago. This was called the Parents and Children Together Study, or PACT. And, we looked to a lot of the research, and we looked a lot to, we have a really strong network of practitioners with whom we collaborate in the city of Chicago, Head Start agencies and directors of other kind of subsidized early education programs. And our conversations and lengthy discussions with them also shaped the design of this intervention, which was designed to boost reading at home for families who were enrolled in Head Start. And let me just say that we landed on reading as our target behavior, more or less because it was very low-hanging fruit. Because as you may know, reading in the home environment is like one of the #1 things that Head Start, the program, wants parents to do at home. So as you know, there's very strong partnerships between what kids do when they go to Head Start and the efforts that the program makes to link to the home environment and support parents to do many of the same things at the home that kids are exposed to at Head Start itself. We also chose reading because it was pretty clear to us that there really weren't any structural barriers in this case to reading, okay? If a child is at Head Start, it is simply not the case that they don't have access to books. I mean, Head Start will send as many books home in the child's backpack as the family wants, and pretty much, a nonstop information campaign to the parents that what they should be doing is reading. So we chose reading, and as I said, because we were able to rule out some of these other kind of usual suspects for why, when we look at the time diary data, we see important gaps by family income and education in who is reading and who is not. So that's why we chose reading in particular. And we chose on the behavioral side of the intervention to target this particular cognitive bias that we've called present bias, which, as I said to you before, is basically just overweighting the present at the expense of the future. And the idea that, again, one more thing I could add is that in our surveys that we do with the families with whom we collaborate for the projects, parents told us over and over how much they like reading when they do it, how much reading is one of the most special times of their day with their child, etc. So again, it has all the ingredients of this should happen, and yet it's not happening to the extent that we wish it were. And so, why is the temptation to not read in the present greater than the commitment to read now for some future payoff? I mean, we simply argue that it was plausible that families just got to the end of the day and the day runs out and you haven't read, and one can easily imagine that either for your own self, or especially for low-income households who have lots of distractions and unpredictable schedules, that it's pretty easy to just get to the end of the day and not do the thing that has all these other ingredients and imagine that you'll do it tomorrow. And so that was sort of the guiding theory for us about what's an important cognitive barrier here. And this is a kind of theme I can show you to imagine in your own daily life of, the commitment that you might make. January 1st is coming up. The commitment you might make to the year ahead of healthy eating, and you walk into the first faculty meeting of the year and you have a plate full of tempting donuts, and you can say to yourself, well, the best time for me to start this new healthy eating plan is tomorrow. And we just sort of, give into this temptation to the very thing we sort of theoretically committed to not doing. So this is all quite simple. And as I said, we're just trying to apply it to this particular parent behavior. So here's what we did. I'm going to explain to you what our field experiment looked like. So we recruited several hundred families from our Head Start partners in the city of Chicago. For this study, we partnered with about 13 different agencies in low-income areas of the city. And we designed an intervention to manage present bias in the service of increasing reading. And here's what it looked like. First of all, we created a digital library. So this was an app that lived on a tablet that was loaded with over 200 books. We do all of our work in Chicago in English and Spanish. So the books were in multiple languages, parents could choose. And the books had a really wide range of literacy requirements. So there were picture books without words, and there were more complex books with words, and parents could choose which ones that they read from the digital library. Critically important was that this digital library was designed so that when parents opened up the app would automatically create a video and audio recording of the book reading session. So you can see that down on the lower left of the screen, it sort of looks like our Zoom call today. This was super important because it allowed us to have an objective measure of reading time using this app. So we're like 100% committed to not asking parents in field experiments if they did the thing we're trying to get them to do, but rather find objective ways of measuring parent behavior, which turns out to be incredibly hard in the home environment. So we worked really hard to create this app. So everybody in the study, all several hundred parents got the tablet with the app, control and treatment alike. The tablets were stripped of everything else. So they didn't have Wi-Fi. They only had this app with the digital library. We only ran this experiment for 6 weeks. It was designed as a proof of concept to see if we were on the right track at all. We did not measure child outcomes because we thought, well, we actually have no idea if this is going to work. So we're not going to commit to trying to, and furthermore, we don't think really 6 weeks is enough to change children's literacy skills via parent reading. So it was a proof of concept designed to just look at change in reading between treatment and control over this 6-week period. Okay, so the control group gets the tablet with the app, and we basically say, we'll see you in 6 weeks. You can take this tablet home. You're encouraged to use it and read with your child. I can say digital devices were not total novelties to these families. Lots of families had similar kind of devices and said, this is fun, use it as often as you like. The treatment group, in contrast, got basically a kitchen sink of treatments designed to manage procrastination or present bias. So first of all, we asked them to set a goal every week for how often in the week ahead do you want to read, how much time, I should say, in the week ahead do you want to spend reading with your child? Parents said, and they made that pledge to a research assistant. So one of our graduate students who was out distributing the tablets at the preschools every week. I will say that parents set wildly unrealistic goals. And by wildly unrealistic, I mean the comparison between what they said they wanted to do and what we know from a National Time Diary study people actually do. And we just took that as an indicator of how important reading was. Okay, this is something parents really want to do. Over the course of 6 weeks, the goals became modestly more realistic, but still like way out of the realm of plausible for what any parent would ever do. Okay, then what we did was about 4 times a week, we sent a text message to parents, reminding them of their goal. And basically you can see here, don't forget to read. The messages were not, you should read, reading is good, good parents read. It was not that. It was simply, let's focus on the fact that you set this goal and remind you of that fact. Let's see, where am I on? Second or third, wherever I am in this list of treatments, they were all bundled together. We gave parents feedback on their goals. So you can see in the bottom right, this little histogram that we developed that we showed parents every week. Here was your goal, here's your progress towards your goal. And do you want to set a new goal? And as I said, the goals diminished somewhat over 6 weeks, but I can say parents really did not meet their goals. But interestingly, that did not seem to sort of diminish their enthusiasm for trying. And then finally, the last element of this treatment, which was bundled together, is we sort of set up a little internal competition it was an anonymous competition among the parents at each Head Start center, such that the parent who had the most number of reading minutes in any given week got a digital badge that danced across their tablet screen at the end of every week with a congratulatory message. And to the winner, it said, "Congratulations, you're the winner." To the others who didn't win, it simply said, parent number 100 has had the most reading minutes this week, and you would know, because you know your study number, that that was not you. So all these things bundled together. It did not involve any, expensive sort of face-to-face interaction. Most of this was done via remote, via text message communication. And here's what we found. After 6 weeks, we found that treated parents read nearly 2.5 times more minutes than their control counterparts. So we were very, very excited. This was, a standard deviation treatment impact in terms of the magnitude. I can also say that, it's easy to get a really huge impact when your baseline's really low. So we're not going to try to argue that this is sufficient to, close the gap in reading test scores by family background. But as a proof of concept, it was very exciting to us. And if we look at the data, because you'll remember that we basically have all these videos that we're looking at, and our research assistants are watching all the videos and just seeing how long they are. And that is what gives us our dependent variable. How many minutes long is the accumulation over all the videos that were recorded in that 6-week period? So we know the timing of when those reading sessions occurred. We know what day they occurred on. What we can glean from the data is that basically the treatment control difference emerged pretty fast and took the form of treated parents were reading 3 to 4 evenings a week for a sort of modest number of minutes. So it seemed to us that treated parents were getting into a habit, a modest habit of reading, whereas the control group was sort of erratic and no particular pattern. As it turns out, the app, which we borrowed from for this study, it's since left the App Store and we've had to recreate our own, but the app was called A Story Before Bed. And parents saw that. So it may have been that there was sort of a cue for them to, associate reading with bedtime. Okay, so this was super exciting, but here on the next slide was really even more exciting to us, and it is the following. What we found is that the treatment yielded the greatest impact for parents who were the most present biased. You're going to say, how do you know who was present biased? Well, we did a very rich baseline survey, and among the data that we collected were about 20 questions where you sort of ask in 20 different ways, do you want $5 right now or $10 next week? We actually used real dollar amounts of money, and to elicit more truthful answers, we entered parents into a lottery to get a payout of money on the schedule that they said that they wanted. It was not actually 5 versus 10, but you get the idea. And when you ask those questions in a sufficient number of times, you can get a distribution of patients. So there is a distribution. There's a normal distribution of patients, even in this low-income sample, and we just divided that down the middle. And we basically said, what's the treatment impact for those parents who were patient, that is, those who were focused on the future, versus impatient on the right, those who were more focused on the present. And you can see that the gain from the treatment was substantially more for impatient parents. This was very interesting and important to us because that's what the intervention was designed to do. So we gained even more than, the treatment effect is great, but even more important is I feel we gained a really important theoretical insight into a particular cognitive barrier that is standing in the way of this particular important parenting behavior. And we have some pretty nice evidence here that if you design an intervention to manage that, it works. Parents who were patient, that is initially at baseline already focused on the future, they were already reading at higher levels. They actually our intervention had much less to offer them. They didn't need those tools to manage their goals. So this to us was really quite exciting. So that's just, again, we have now, we've been at this now, I guess, almost 8 years, and we have a number of field experiments under our belt. We have lots to learn, but I'm excited by the fact that I think we still have enough evidence that we can stick with our original theorizing about why this might be a good idea. And that is simply to conceptualize parenting not as a style, but rather as a series of decisions. And to think about what are the factors in the social environment that shape the decisions that parents make. And, so much interesting work to be done to identify what are the factors that do shape decisions. We're very interested in stress. We're interested in information. We're interested in peer effects. We're interested in mental attention and fatigue. And we're interested in these cognitive biases. And again, these are really universal factors. Like the factors that I've just listed shape the decisions that all of us make. But we've been interested in how they shape. To what extent are low-income parents more exposed to these factors than their more economically advantaged peers, and how does that matter? Again, reaffirming that the optimal decision is not what I say you should do, but rather what you said you wanted to do. And so that just means I'm just going to say a lesser focus on an information approach to behavioral change than an approach that structures the decision-making environment that you make the decision that you want to make. And so this really just says everything I just said, so I won't spend much time on this slide. Lots of tools at our disposal for managing decisions. And then of course, from a researcher perspective, there are just a huge number of limitations and cautions. This is all very new. It's very new to apply this framework to parenting decisions. I think it's probably very under-theorized, and that's something that's important to me as a challenge to solve. Again, I started this talk by saying that the gaps across family background are driven by structural factors, by gaps in information, and by cognitive biases. I think we have very little idea how those map onto specific decisions we care about. I'm interested in trying to understand sort of spillovers in behavior. So if I intervene on one behavior, does that organically change other behaviors? That would be efficient if that were the case. I don't think I can sort of have a different intervention for every single decision I want you to make and text you forever to remind you to do 100 different things. That seems implausible. And of course, making a habit of whatever behavior change I find. And here again, I'm sure we share this goal. Once I'm done with my intervention and I leave, have I helped you create a habit that you are able to take up on your own? So these are all the things that we're working on. And again, I think what I'm just probably going to spend, a long time on is understanding more about why parents make the decisions they make, in really keeping the focus on families and in seeing how far we can push this behavioral insights lens. Again, as just one part of a broader toolkit, as a complement to other approaches, and see how far we get. So that is it, and I'm gonna stop the share so that I can see you better, and then you'll hopefully have questions. So Anne, you're on mute still.
Thank you so much. This was really fabulous, and I loved just about every aspect, but very much your very measured pace that made it easy to follow the argument you were making and then the work that you've been carrying out. I'm actually, Kay and I have arranged that Kay is going to help in fielding the questions. I think we had questions from about 5 members of the audience. Kay, do you want to walk us through those and give Ariel an opportunity to answer? Pretty thought-provoking questions, I must say, so I'll stop talking now.
Yeah. Okay. What I'm gonna do is see if I can pick the ones from students first. I've just been looking at let's see, we have a question here. I'm wondering if there are differences in aspirations of parents by different characteristics, observable and unobservable, and how your analysis would account for these when ascertaining the difference between actual behavior and aspirational behavior.
Right, that's a nice question. I'm sure there are, because not all families want to do the same thing, of course, nor should they. I think where we're starting now, given that our work is so young, is for the behaviors that pretty clearly most parents say they want to do. And again, I mean, that's just the low-hanging fruit. And as I said, reading is the obvious example. We have yet to find a parent who says, like, I don't want to read and I don't think it's important and like that. So I think there must be a sufficiently reasonable set of common things that are shared goals among all parents that are going to give us enough to work on for the time being, while 100% agreeing that families will also have different sets of goals for other things.
Mm-hmm. Okay, great. We had a question. Did you assess parents about their own reading ability or literacy at baseline? And then kind of connected to that, could you speak a little bit, were families English speakers? Was anything translated to other languages?
Yeah, sorry, I thought I said that. We do all of our work in English and Spanish. So unfortunately, if that's not if neither one of those is a family's primary language, we don't have the capability of translating beyond that. So families choose between those two languages. In what language do they want to take the survey? We have Spanish-speaking research assistants, and the library, as I said, offered both English and Spanish books. So this particular study, we didn't have a large enough sample size. It's really only about 175 families total to do a lot of interactions by family language.
Mm-hmm.
And then, no, we didn't measure parents' literacy to accommodate the fact that parents would vary in their literacy skill. We populated the library with different kinds of books, as I said, from books with no words at all, that picture books that parents could look at and just talk with their kids. So, the time that we called the dependent variable was the time spent engaged with the book, whether the book had words or the parent was reading it or not.
Mm-hmm. Okay, great. Let's see, we had a question here. There's a lot of evidence from behavioral economics about simply the cognitive load of poverty and the constant worry and trade-offs that someone has to make when they have no margin of error. Have you tried to measure or explore this more global impact of poverty on decision-making?
Yes, we're very interested in this concept of cognitive load and stress. And again, we weren't able with this study with this, too small a sample to interact the treatment with families' levels of stress, for example. One of the things that I'm inspired by with this approach is that if we find plausible a couple things. First of all, I'm hope that the way we do this intervention is not onerous for parents. So it's very light touch. We're not asking parents to do a whole lot, I think. And we're hoping that if we help to create a new habit, well, then there's little cognitive load on parents, because the whole beauty of a habit is that it's done without, too many cognitive demands. So I think there's two things. We're interested at the same time in our broader work in the lab in how can we help. What is the role of cognitive load and cognitive stress in decision making, and how can we measure that? And manipulate that and help families manage that. So maybe you could imagine a two-pronged intervention that does along the lines of what I just showed you, and has additional elements that help parents manage stress in the moment, because we 100% believe that the reason you might not do something is because you're stressed in the moment. So you just don't do it. I'm sure that seems absolutely true. So I think I totally agree with the question, and we're working on some of those things now.
Okay. Great, thank you. We had another great question here. I won't read it all, but basically about continuing this work into adolescence. So acknowledging that it's not just babies, young children, but important for parents as children grow. So thoughts about how to bridge the infant, child, adolescent continuum for optimal young adult outcomes to support parents to do the kind of work you described throughout. Impact of sustained reminders or boosters through different developmental stages.
Yeah, that is wonderful. We obviously, parents make decisions on behalf of their children for a super long time. It doesn't stop at age 5 or age 15 or so I think that this approach theoretically is applicable to all sorts of parent decisions, no matter what age is the child. I can say myself, I'm not an early childhood person by training or interest. I'm a parenting person. And so we started with children at this age because we were able to make these great connections and practitioner relationships in our community. And it was an entry point for us to do this work. So there's a little bit of a practicality to why of course, I also believe early childhood is important. And I also am compelled by the idea that there's huge disparities in the kind of out-of-home early education to which different kinds of children have access, and the importance of supporting parents in the home environment. We have been thinking about, what does this mean for adolescents? What are the relevant decisions? How can this approach be used for certain ones of those? So I really hope it is kind of a more universal approach.
Okay, so maybe we have a few minutes. I'll see if anyone wants to come off mute. See if there's any last. Emmy, yeah. Great, yep.
I put this in the chat. It was answered to some extent, but you explained how you adjusted for the structural constraint of having books. But what about structural constraints such as working while the child is awake, working a shift that doesn't overlap with your child's waking hours, or your child spends time in another household? Is there a way of adjusting for those types of factors?
Yeah, that's a wonderful question. And of course, we didn't. Families could use, the tablet and the app whenever they wanted. But of course, exactly as you say, if you're working while your child is at home to be read to, that's not going to happen. And further, so in a regression, we control for some of these things. Right. So that's not, I think, the answer you're looking for, because you want to know how might this differ for different circumstances. And all I can show you is the kind of average treatment impact that we got. The other thing I can say is a limitation in this sort of proof of concept work we did is that we really did ask families, who's the primary caregiver in your household? And this was an intervention directed to that person. Now, they could nominate whomever they wanted. It is mostly mothers. It's about 80% mothers. It's about 10% more grandmothers. so we control in the regression for these structural factors, but we're also, we were trying to see if we could shift the behavior of one person.
Right.
And you might say, well, that's kind of dumb. If you want the kid to be read to, who cares who reads? But there's different questions you can ask here. And so I think you give a really nice example, like, well, if this person isn't home, someone else can read.
Exactly.
This is not what we tested.
Right.
But I agree very much with the spirit with your question.
But your answer really gets to sort of how this might be adjusted, or you might, broaden the intervention to allow
For sure. It could be okay.
Yeah, no, I was really curious. It's like, how could you adjust this? Right?
Yeah. There's no reason it needs to be for the primary caregiver. We just, it's a sort of a different question to say this is for the family and we want anybody to do this, and maybe it would look different. But that sort of introduces a super interesting idea of peer effects and joint decision-making. Decisions that parents make in the home environment are not made in a vacuum. They're made with other people, including the child themselves. So there's just lots of interesting things to think about.
Thank you.
Well, I'm going to jump in here because I think we're at the end of our time and folks here must get on to other classes and so on. But I think this has been a fabulous seminar, and I thank you so much, Ariel, for sharing with us. You've engaged a huge swath of the members of our department who focus on many different research areas, with all of whom I think could find connections between your work and what they do. So thank you very much. I hope everyone will join me in thanking Ariel.
Great. Thank you so much. I can't wait to talk to you more.
Yes.
Okay. Bye.